not that fold, here. And then I gently, you have pictures of step by step of this in your paper things as well. My fingers only come through my sleeve once my hand is inside the glove, okay? All fingers through. This is why your hands have to be super dry. That's it, I leave it. See, my sleeve is all the way up on my palm, perfect, not a problem. Now, with my right hand, I go into the pocket here. If I need to use this hand to put this down, keep it down, I do that. But I go in the pocket now. Now I gently put my fingers in the glove. Fine, wiggle through. Take your time. Don't rush, don't panic, don't stress. Because if you rush, if you panic, you stress, then you make a hole in the glove. Just know what is sterile, what is not sterile. Everything out here at the moment is sterile. You can touch everything. It's your hand on the inside that is just clean. It's not sterile. Skin cannot be sterile. Okay? So now, I pull it up. Pull it up. Look, if you need to pull up your sleeve a little bit, do that. But it shouldn't really go any further than this. Your sleeve should be on the palm of your hand, back of your hand. Why? Because this is normally not that elastic. So if you pull up your sleeve all the way to here, during surgery and movements, this could go down, the sleeve can come up, and suddenly you're exposing your wrist. This is also a bit extra. It feels nice. Once you get used to that, you can't do anything without having that extra feeling. It's mental memory. Now you go in with the other hand into that pocket, and now you'll be pulling this up. And then pull it a little bit. Great, we're done. And now I'm waiting for my scat nurse. So what do? I stand like this and pray that everything's going to go well. Okay. Now, are these latex free or are they latex? Sorry.
That makes it free.
Yeah. Okay. So now we go back to this. So now I'm all ready. I'm all done. Now I'm coming here. Now, for me, now that I'm clean, I go on the inside. I don't go on the outside. Scat nurse on the outside, clean nurse on the inside. You just have it as a habit. You go on the inside, they go on the inside and roll it up. In that room, have you put the blue tags on the wall? Yeah. So if your big surface is against the wall, what I recommend is that if you have a big sheet like this, you go from inside. And remember, all on the inside, this is all sterile, so I can touch all of that. Then I go against the wall like this, not all the way full out. Do you want to come and show how you will do that? Then the scat nurse takes the edge. So yeah, so you take the edge and then you can tape it on the wall. So you end up, because this bit is not going to be in the surgical area, but now you have covered the wall with sterile as well. Yeah, here you can push it onto the blue tag. So we've put blue tags on the wall, which is what you can do in your practices as well. Push it onto the blue tag, or I can push it onto the blue tag as a sterile nurse, and then you can get the scat nurse to put tape on just for insurance so that it doesn't, in the middle of surgery, doesn't fall onto your thing. But if you have a tray separate like this, then you make it fall, and the scat nurse sits on the floor as we talked, and just pulls the sides down. So the scat nurse here can help, and the scat nurse takes everything down on the sides. Does that make sense? Hold on. Okay. Then I cleaned up over there. I have that, my gown sheet that is clean, that is sterile on the inside. I put this is the surgeon's gown and towels, onto that sterile on the other side. Does that make sense? So that's all clean. Then we have the parts here. Depending on what kit you have, these are the stickers. I like the stickers on the areas where you want it to be see-through. I don't like using these on handles because they just it's just so difficult. This is the patient's ones. This goes on the side at the end. Now go through your pack and see what you have here. Okay, so I have another sheet here that I can put on my third surface, and it has a sticker. I utilize the sticker. Now, because it comes folded like this, I know that it's not super big. Because if it was big, it would be